But there are a few questions that have come up that I want to ask to specific people where they are directed. And again, thank you very much for giving us that your speech. Now, the first question, maybe I want to draw the attention of the PS. The PS, there are three questions for you, which I request that you answer in brief. The first question comes from several participants, one from Anthony Kigaru and also from Diego Shirma, and all of them are interested about suitability maps. To sum up, they are asking how accessible are the suitability maps in Kenya and outside Kenya, particularly in East Africa. How accessible are these suitability maps that you mentioned? Another question that goes to our able peers here is that you mentioned considering land consolidation, which may help, may increase productivity. But the question is, how possible is this under the current land ownership status in Kenya? Is it possible? And the last question comes from Alphonse Ochen from Garissa University, that the PS you've mentioned that some strategies we need to put in place includes proper soil testing. Is it possible for this strategy to reach the small scale farmers, or is it only for large scale farmers? So PS, I don't know whether you are with us, but those are the questions. But in the meantime, I also want to pose a question to Dr. Elizabeth. Dr. Elizabeth Kimani, there's a question from Anthony Kigaru, and he's asking, please tell us more on undernutrition and overnutrition in urban setting. And I also want to add that you mentioned about women being obese. How is this? Dr. Kimani, because I can see our peers is not maybe settled to answer. Dr. Kimani.
Okay, thank you so much. Yeah, so the information I sent about, I gave about the close to 50% of children in urban poor settings, that is in the slums, being stunted. That is from the research we did, but also someone from Cambridge had also done this a similar study and found the same in Ibera. The findings about the women, close to 50%, that's 48% of women in Nairobi being either overweight or obese, is from the Kenya Demographic and Health Survey. So really there is this coexistence of under and over nutrition. And there is the issue of the kind of food that people are eating. So in terms of undernutrition, mainly it's because of lack of food. Like this is in urban poor settings, and I said close to 80% of people, of households are food insecure. So this coming from food insecurity and other factors that may be in the space that limit children from accessing adequate food and growing optimally. But then the issue of people being overweight or obese, the problem of not eating healthy diets, we know that there is the recommendation, like by the WHO, is that people should be eating 5 servings of vegetables or fruits. And then the planetary health diet that is proposed is more like you eat more vegetables and less of like the other foods, the animal foods and all that. But the problem with what we have at the moment is like there is the inequality in the food distribution. So people who have enough are overeating. They are eating more than they should, and people who do not have enough are not accessing what they should. So and then again, eating like also processed foods, like processed carbohydrates, and the kind of food, these fast foods and all that, could also be resulting in the kind of overweight and obesity that we are seeing. So this really, this nutritional transition that is happening, where people are as transitioning from this eating the traditional foods that they were eating before traditionally, and now moving to these fast foods that have come to the market is also a problem.
Thank you, Dr. Kimani, for giving that elaborate answer. I'd want to pose a question to Mr. Emmanuel. Two questions for you. One, how do you determine a pesticide is unsuitable to use by farmers, for example? How do you determine that that pesticide is unsuitable for use? And the other question comes from Dominic Oringo, also a student from Garissa University, and he's asking, what is the effect of pesticide to food security, knowing that he comes from a narrow county where they depend so much on this pesticide to grow wheat and maize? If maybe these pesticides are banned, are they going to be food insecure? What measures are they? What effects are they going to experience? Mr. Atamba, thank you.
Yeah, thank you, Prof. I think one, we do not determine. It's not for us to determine what pesticides are safe to use or not. We have the Pest Control Products Board, which is a governmental institution that is working on that. So they have all the protocols, they have all the processes to do that. What we did was, of course, to just raise questions that why do we have products that have been found to be causing cancer and to be neurotoxic and to have reproductive toxicity in Europe being used here? So that is the only question that we raise. But of course, the process to evaluate products, that is the responsibility of the Pest Control Products Board. But we also, as consumers, we also have the capacity and the right to question, because not anything that is on the shelf is safe. Yeah. And this is the notion that farmers have. And that is why even the same pesticide companies have a big problem and a big task to educate their own customers, because farmers think that because I bought it from the shelf, then it is safe. And you find even farmers using pesticide containers to put milk in it after using it. And I think this is a conversation that we have had in public, and people know that this is the true fact. So all pesticides are poisons. That is why they're called pesticides. So the side is a poison. So all pesticides are poisons. Let us start from there. The question is, within our context and with how we use things and with how we use pesticide products and how we are able to monitor and regulate the use of products beyond even pesticides, even anything else, atadawa, medicine for, that you buy from the chemist. How do we regulate that? We have systems to monitor how people use and interact with these products. Based on that, that is where we are making a very concrete suggestion that it will be very unfair to have products in our market that have been banned in other markets, considering that we are even at a more risk of getting into contact with these products, either through spraying or through consuming products that cannot be traced back, and where farmers are not observing pre-harvest index or post-harvest, pre-harvest index. So the other question is that some of the pesticides are used in wheat and all that. I said that is the current situation. People are using pesticides, people are using chemical fertilizers, but there are alternatives to that. There are other integrated pest management practices to prevent, for example, the occurrence of pests, to manage weeds, farm hygiene, simple things to manage diseases and all that. That is where we want our people to start having a conversation around. Because also, remember, the products are also very expensive. So that's why I'm saying they are not doing any added value in our food systems. They are not doing any added value to the farmers. If a farmer can farm without a pesticide, then everyone is winning, because the consumer will get a product that is chemical free, and also the farmer will be able to have more money in the pocket because they didn't use a product. But we are not calling for a blanket ban for all the products. That is what we are saying, that we are talking about reviewing the products we have in the market to make sure that what is there can be used and can be safe for consumers who have a right to save food. And also the farmers, because, and if you go to the North Rift, you talked about Narok. I come from Eldoret and I farm in soy. the level of misuse and mishandling of pesticide products, we are waiting for another pandemic that is going to come in those villages where farmers are spraying pesticide products as if it is water. And I'm sure anyone who has had interest to observe will agree to that, that we need to really educate our people to understand how pesticides even work and how dangerous they can be. But we are not saying that we need to ban all the pesticide products. There are specific active ingredients we have raised and they are under review. Thank you.
Okay, thank you, Mr. Tamba, for that. And really, time is not on our side. I want to remind all our viewers and participants that we are live on Twitter, Kenyan on Twitter, so you can log on and you can find us there. So we are very much appreciative of what we are doing. And I want to bring it to a close at this juncture because of time. And I want to appreciate all of you. What we've got from this good talks that we have this morning is that we are not doing so well in terms of food security. There's a lot that is need to be done. There's the need to use our indigenous knowledge. We blend our indigenous knowledge with the science that we have so that we be food security. We need to reconsider the use of our pesticide. Also, there's the issue of whereby we are supposed to give proper and adequate education to our smallholder farmers who are mostly providing food for us, and this food must be safe. So when we are equip them with adequate education, definitely we are going to have healthy diets. Thank you very much.